Hello everyone. A new study has found the key that unlocks Covid-19 coronavirus as the world hits over 1 million confirmed cases with a death toll of over 50,000 and multiple Wuhans explode in Europe and the United States. A groundbreaking new study has discovered the key that appears to unlock how Covid-19 works. A Covid-19 honey zone has been discovered by the new study, which has gathered evidence from around the world that suggests the right level of humidity and air temperature in an area can create a precondition to trigger the virus to start multiplying and transmitting infections at a fast and virulent rate. This study throws light on how the virus is triggered, in what conditions it spreads best, and when it could end. Flooding in Europe, China, the USA and Australia in recent months has raised humidity levels, which appears to be a factor in the onset of Covid-19. The Covid-19 honey zone, the phrase coined by the author Karen Wolfson of World Health Alert Crisis, often has high humidity levels between 60 to 100% and may have some low humidity levels of less than 30%. The air temperature in this honey zone appears to be up to around 18.5 centigrade most of the time. The mean temperature of the honey zone appears to be in the range of up to 12.5 centigrade, depending on the unique combinations in an area or country. The following examples currently have among the worst outbreaks in the world, and the study has found them all in the Covid-19 honey zone: Bergamo in Italy, Paris in France, Barcelona and Madrid in Spain, Berlin in Germany, London in the UK, New York in the USA. Seoul in South Korea has also been in this honey zone and has implemented very strict tracking, tracing and isolating of cases, allowing it to take back control. In China, the worst hit city, Wuhan, was in the Covid-19 honey zone during the surge of its outbreak up to around mid-February to the beginning of March, when the air temperature began to edge upwards. But the measures in place to hold back the virus must not be lifted too quickly, as the risk of dipping back into the honey zone or moving into the Covid-19 outer zone remains. Above the honey zone is the Covid outer zone, where the virus can multiply and spread, but at a slower rate. The outer zone may have similar humidity levels to the honey zone, but the air temperature tends to be higher for sustained periods of time, going up to around 31 centigrade, with the daily mean temperature around 13 centigrade and above, and gradually trending upwards. São Paulo in Brazil and New Delhi in India fall into the outer zone. If humidity levels are high, coronavirus can still find ways of spreading in even higher temperatures, as it has in Lagos in Nigeria. The virus finds opportunities to spread infection in crowded dwellings, in areas where sanitation is poor, and at events or in public places where people are close together. COVID-19 may not operate at full potential in this outer zone, but can still be effective and transmit with little effort where it's given the opportunity to infect individuals in close proximity through droplets in a cough or via surfaces in crowded public transport, religious settings, or at busy events. Hotspots can also spring up in a dense population, in crowded dwellings, in areas where soap is not readily available and where there is poor sewerage disposal. It is important to remember that COVID-19 has the ability to evolve and mutate, and the way in which it could mutate or adapt and when this could happen cannot be predicted. At humidity and temperature levels outside this honey zone, an outer zone COVID-19 appears to find it more difficult to multiply and spread, which causes the chains of transmission to break more often and the virus to operate at a lower level. However, coronavirus may still be able to infect when in a sluggish mode if the variables provided assist easy transmission, such as in overcrowded slum areas or prisons and where there is little or no running water. Keep watching to find out more about this groundbreaking study that unlocks the key to COVID-19, the deadly coronavirus. The study analysed countries around the world and identifies conditions that may contribute to the onset of COVID-19 and how different areas are impacted by the disease. Humidity and air temperature are two factors that may help trigger the conditions for a COVID-19 outbreak. But there are other contributing factors. It is important to consider all the relevant factors when making projections or assumptions, which vary from country to country, in order to determine how an outbreak of COVID-19 in any particular country or area may be likely to unfold and tail off. How the war unfolds and what to do. It is the variables within each country and measures a country takes that determine how the coronavirus outbreak unfolds there. When the conditions are present to create the possibility for the virus to surge if it is in that area, or the virus is brought to that area by a traveller. There are many variables that impact an outbreak, which include the capacity of the health system, the availability of medical equipment, the number of intensive care units, and the number of health workers. Then there is how vigilantly a country tracks, traces and quarantines cases of coronavirus, as this is vital in this war, as you cannot fight the enemy blindfolded. Other measures implemented and at what stage are also crucial, such as introducing a stay-at-home policy, closing schools and universities for a period of time, asking people to work from home if they are not in essential jobs, closing shops apart from supermarkets and pharmacies, banning big gatherings, limiting public transport, and last but not least, communicating with the public effectively so they understand their role and responsibility in this battle to physically distance, wash their hands and do their best to protect themselves from infection, which helps protect their family and community. The UK, for example, came round to introducing these weapons, and is now ramping up testing for the virus in a massive surveillance effort after closing potential transmission hubs like schools and universities 2 weeks ago. Dr. Kakova, part of the WHO leadership team, underlines that this virus is characterized by transmission by those who are asymptomatic, adding that they actually are pre-symptomatic, and 75% of those who are asymptomatic go on to develop symptoms. The UK has a wonderful health system in the NHS, but even the best health systems in the world find it hard to cope with an unprecedented surge in critical cases during a pandemic. India has this week announced a $24 billion package, including food rations for 800 million disadvantaged people and free cooking gas for 80 million people for the next 3 months. These humanitarian efforts are mirrored all over the world. However, Tedros, leader of the World Health Organization, said the greatest concern is that many developing countries cannot support a lockdown, and measures richer countries are able to put in place. As a result, he said, there is a call from the World Health Organization, the World Bank and the IMF for debt relief for those countries so that economies and communities do not experience crisis. So, let's move on. How coronavirus ticks. How did the pandemic happen so quickly? And what are the variables that have determined the way that outbreaks have unfolded in different countries? That brings us back to the new study by Karen Wolfson at World Health Alert Crisis, which reveals the Covid-19 honey zone and the Covid-19 outer zone, two of the variables that may help determine the onset and tailing off of the virus from its potential when it multiplies and transmits infection at a furious pace. Keep watching to find out more. Humidity and air temperature levels in countries around the world that have COVID-19 cases were studied to identify weather patterns during the course of their outbreaks. The countries focused on here are mainly those that have been worst hit by the outbreak, in order to identify triggers, similarities or differences, although other nations were included in the study. There has been severe flooding and storms around the world in recent months, including in Europe. Some of the countries hard hit were Italy, Spain, Germany, France, the UK, Switzerland, Belgium, and the Netherlands in Europe. However, the United States, Iran, Turkey, Brazil, and China also had storms and floods. Let us take the UK as an example. England has seen more frequent flooding recently and was hit by floods between November 2019 and February 2020, which was the wettest month recorded since records began. That caused humidity to increase, which is the amount of water vapour in the air. If there is a lot of water vapour in the air, humidity will be high. London, Birmingham, Glasgow, Surrey, Hampshire, Sheffield, Cardiff, Kent, Cumbria were some of the areas most affected by the storms and flooding in the UK. They are also among the places with the most cases of COVID-19. It appears that when COVID-19 arrived in the UK, brought in by someone who had recently travelled to Singapore, where he is said to have been infected by the virus, the humidity and temperature levels were in the COVID-19 honey zone, allowing the virus to multiply with abandon. The Wuhan factor. Wuhan in China is often called the City of Rivers. It lies on the Yangtze and Han rivers and is prone to flooding. The humidity in Wuhan was high in January 2020, regularly reaching into the 80s and 90s at the top end, and began to ease a little in mid-February 2020 with a few clusters of daily highs in the 60s and 70s, and drifted down a little more in March 2020. However, overall, humidity remained high. The temperature in Wuhan ranged from lows of -2 to highs of 15 in January 2020. The mean temperature showed a gradual upturn from around mid-February 2020, yet it remained in the COVID-19 honey zone until around the 6th of March 2020, when the mean temperature started to drift into the COVID-19 outer zone more often than not. The latter was a helpful factor, but it did not account for the radical way in which China waged war on the virus and got the number of cases and deaths down so fast, with the introduction of powerful measures to break transmission that had a dramatic impact, very quickly bringing down deaths and cases to just a few. The package of measures included free testing and putting everyone who tested positive into isolation, building temporary hospitals, converting stadiums into patient centres, postponing non-urgent medical treatment, tracking every single case so they knew where the virus was, a countrywide shutdown, restricting movement within and across borders, stopping movement in and out of Wuhan and other cities in Hubei province. People were told to stay at home and food was delivered to them. Whatever criticisms China receives for not including people without symptoms in its figures, the measures it took to hold back COVID-19 were unprecedented, and they worked. The weather was also in their favour, although at this stage it was not the major factor that defeated coronavirus. China's crackdown was the vital component, and hopefully the weather will be in its favour as the measures are lifted, which should help to keep COVID-19 at bay. As the number of confirmed cases heads into the millions over the next week, Europe and the United States have not only become the epicentres of the pandemic, but their figures reveal outbreaks in each of their countries that have bigger case numbers and have much greater death tolls than the whole of mainland China put together. These are only the confirmed figures. The actual figures are even higher. Bear in mind too that how countries calculate their data varies, so a comparison of figures between different nations may not be entirely accurate. Some countries also test more widely than others, which could indicate a more aggressive approach to finding the virus and breaking its chains of transmission that could ultimately lead to victory in their region. The rule of thumb is never give up. The virus is accelerating at a furious pace, but the world has come together in united action like never before, And our powerful actions will eventually beat the virus, though our war will not be without casualties. I feel proud of all our governments, health workers and individuals around the world who are doing their best to hold back the virus. Every individual plays a part in this war on a billion fronts by practicing physical distancing while igniting social interaction in different ways over the internet in order to stop the virus from transmitting infections. In the trenches are our treasured health workers, the soldiers and heroes in this war who are fighting to save lives on the front line. The other heroes are those guiding the world in this time of pain, when some countries are in the middle of the fight of their lives. They are the leaders of the World Health Organization, Dr. Tedros, Dr. Ryan, and Dr. Kakova and their colleagues. Every continent except for Antarctica has reported cases of coronavirus. New records are being set every day. The United States has rocketed to over 200,000 confirmed cases, more than twice the number confirmed by the whole of mainland China. Yet its death rate is a smaller percentage of the total number of cases than a number of other countries, which suggests its massive war effort is helping to reduce the number of lives lost. Tragically, Italy has confirmed the highest number of deaths so far, with 13,155, 3 times as many as the United States, and Italy has a total of more than 110,000 cases. Spain has the second highest number of deaths so far, with 10,003. Meanwhile, Germany is about to report it also has more cases than mainland China, but it has a death toll of 962, which is much smaller than countries with a fraction of the same number of cases. What can we learn from the way Germany, China, and the United States and other nations clearly fighting hard to keep down the number of fatalities? Amidst this turbulence, the World Health Organization has become the guide. Tedros, the WHO leader, and his team have experience of and procedures for pandemics. They have become advisors to governments, health ministers, community leaders and business leaders around the world, and they have been ringing the alarm bells for action for some time now. The package of recommended measures can be found on their website, as well as videos that everyone can access about coronavirus. They are holding the hands of people around the world who are overwhelmed by what their countries face and showing them a path of steps to follow in order to hold back the virus and take back control. How to attack the virus now? Tedros, the leader of the World Health Organization, said today, "This is the first ever coronavirus pandemic in the world, and there are many unknowns. We are in a learning process and we have to learn from our actions." He added, "We have to fight in unison this unknown and dangerous virus." Dr. Ryan, part of the WHO leadership team, said we need to continually assess the pandemic to show what works and to make sure countries have a tailored approach to fit the different variables. Tedros underlines that developing countries are not able to support the lockdown of their country to hold back the virus, where lack of access to water and cramped conditions can be a challenge. Dr. Ryan warns that this disease may accelerate. He urges leaders in government, business, communities and religion to encourage physical distancing during the pandemic, and build the architecture to get out of the cycle of lockdowns, control this virus and eradicate it, he underlined that the key is to adapt, adjust, implement and measure over and over again until we control the disease. It is hard work, but with it comes the possibility of control and eradication. Dr. Kekova, who is also part of the WHO leadership team, said, "Every person on the planet has a role to play, and they need to feel empowered to protect themselves. And if they take every precaution to protect themselves from the infection, they can prevent onward transmission to someone more vulnerable, which is a responsibility you have to protect yourself, to protect your family, and to protect your community. Everyone needs to understand they have a role to play and a duty to prevent people from being infected. It's a responsibility to everyone." The number of coronavirus cases now is 10 times the number that were confirmed in mainland China, and the death toll of over 50,000 worldwide, many times bigger than the 3,312 confirmed in China. It's clear that the massive action China took to break the chains of transmission during the outbreak helped to reduce the number of cases and reduce the number of deaths, although it's too early to tell if there'll be a second wave at some point. The findings in the study by Karen Wolfson of World Health Alert Crisis may be useful in working out where the COVID-19 honey zones and COVID-19 outer zones are in the world, so that countries can make preparations in case of an outbreak in the future. Of course, when a vaccine is developed, there will be greater protection from this disease, although it may take time to roll out. The big issue. Countries around the world have done and are doing their best to fight back the new virus. But there appears to be a bigger issue that needs tackling in order to stop COVID-19. The floods around the world created perfect conditions to jumpstart COVID-19. Travel around the world spread the virus, which took hold most vociferously in countries that had the right levels of humidity and temperature to allow it to multiply and spread infections at a furious rate. This brings us to the core issues. I have taken time to study factors around the world with no preconception as to what the ultimate finding might be. What I have found is quite alarming. It is evidence of the possibility that COVID-19 was triggered by climate change. I leave this thought with you to take this further and to explore whether it is time for us to change how we live our lives and what we do. At this stage, I am shocked by my finding, but happy that there is an explanation, for if we know more about what we are dealing with here, then there is more likelihood that we can do something about it. If you want more information about this study, please contact World Health Alert Crisis by leaving a comment below this video or sending an email. Thank you for listening. See you soon, hopefully.